Dr. Sahada Alolo, Director for Ottawa Guiding Council for Mental Health and Addiction. She will be presenting Transforming Mental Health and Substance Use Crisis Response in Ottawa.
Thank you for coming. So I thought I would go into the research by talking a bit about who we are and why we undertook this research in the first place. So I am the co-director for the Ottawa Guiding Council for Mental Health and Addictions in Ottawa here. So a bit background about it and who we are. So Ottawa Guiding Council for Mental Health was set up in 2001. And it's a representation of different organizations from the health sector, from public institutions, including Ottawa Service, Ottawa Police Service, the City of Ottawa, Public Health, and other community health centers as well. So these are some of the organizations that belong to the Ottawa Guiding Council for Mental Health, and they also belong to networks. So all of these people came together for one purpose, and I'll be telling you that in a minute. The reason why they came together was because there was the need for change. As we are all aware, the Ottawa Police Service in our city has become the de facto mental health and substance use crisis responders. And the reason is because they are the only ones that are open 24/7, have the resources to be able to respond to people when they are in mental health crisis. In our city here and in most cities in Canada in general, we know that people have experienced trauma, injuries, and in our community in particular, unfortunately, Mr. Abdirahman Abdi from the Somali community was killed by the Ottawa police, and Greg Ritchie from the Indigenous community as well. We also know that there's significant underfunding of mental health and substance use programs in our city. And that's, again, due to the lack of capacity in our city to be able to respond to people when they are in crisis. So the Ottawa Guiding Council was set up with one main purpose, which is to, they were mandated to establish a strategy to support an enhanced or new mental health addiction crisis response that would improve the outcomes for those experiencing crisis related to mental health and substance use in Ottawa. And the reason is that, there was a loud cry in our city from activists and from community service providers calling for change in our city. It went to the City of Ottawa, and eventually the Ottawa Police Service Board passed a mandate for the Ottawa Guiding Council to be formed and to undertake this mandate. So in 2002, I was hired with my co-director to lead the Secretariat of the Ottawa Guiding Council for Mental Health and Addictions to undertake a research. And so the purpose of the research was to find out from community members what are their experiences when they are navigating the system in terms of accessing support for mental health and substance use. So this was the methodology we used. So we set up, as we looked around in the city, sometimes when we want to do community consultations, there are certain barriers that people face in terms of actually even participating. And we noticed that the voices that needed to be heard most, sometimes these barriers prevent them from participating in such community consultations. So the methodology we used, we were very intentional as to the people we were looking to speak with. So it was very purposeful. We also used the snowball approach, speaking to other people and asking who else do we need to speak to. So the community-wide consultations led to speaking to about 1,200 people in the city of Ottawa and gathering their feedback on how this was supposed to go. So we went through focus group discussions, interviews, surveys, using semi-structured discussion guides. We also conducted one-on-one interviews and then used the surveys to be able to gather the information. In addition to speaking to people and gathering their opinion, we know that there's a wealth of research out there already, which already talks about alternate ways of responding to people when they are in crisis as a result of mental health and substance use. So we conducted a literature review of what is already out there. The city of Ottawa also conducted an environmental scan, which helped in our approach as well. And so we used that. And that environmental scan, we actually wanted to know in Canada, which cities are already using alternate ways to respond to people. So we looked at Vancouver, we looked at Toronto, and we looked at Niagara. And we also looked at the Kahoot program, which has been in existence for over 40 years now in the United States, in Oregon. These were some of the, because we were very intentional as to who we wanted to speak to, and we wanted to make sure that we are capturing the voices that are affected the most. And so we were very, very intentional as to the people we approached. Due to, using community champions, we were able to go into the Somali community because we know that Abdirahman died from the Somali community because of mental health and interaction with the police. So we were intentional about that. We reached out to the ACB community. We talked to other racialized groups, to LGBTQ plus community members, being intentional about reaching out to the Francophone community as well. And we also know that in Ottawa, we have rural areas. So we went out to the rural and urban areas as well. And most importantly, as I was saying earlier, when you are conducting community consultations, some of us have privilege to be able to participate, others don't. And our homeless folks will not be able to participate on Zoom or come into a community center to be able to have their voices heard. So we actually went out onto the street and spoke to the street-involved people as well. And then we also sought out people who use substances. We went into the faith communities to understand the congregation and how they deal with mental health and substance use. And of course, we targeted newcomers as well. And then we spoke to youth ages from 12 to 24. In addition to speaking and getting residents' perspectives, we also wanted to understand the perspective from the service provision point of view. And so we targeted service providers as well to understand how they support clients when they are accessing support for mental health and substance use. And so these are some of the people that we spoke to in terms of service providers. And most importantly, you cannot do this without the voices and the experiences of people who have lived it or are continuing to live it. So again, we were very purposeful in that. We put out a call for people who have lived and living experiences with mental health and substance use to apply to be part of a reference group. We had over 70 people who applied within the city of Ottawa. We ended up shortlisting about 11 members that followed us throughout the journey. And what we did with the reference group, we started by mapping their experience. So we did a mapping workshop where we wanted to understand how they deal with mental health or how they deal with substance use, where do they go, how do they navigate the system to get support. And of course, after gathering all of that data, we did validation, and the reference group was one of the points where we were able to get their opinion in terms of validating the data, and also gathering their input in terms of how we come out with the recommendations. So what did we ask people? There were several questions, but the three main questions that was at the center of this research was, we wanted to know, where do people go to access mental health and substance use crisis service and supports in Ottawa? And the reason for that question was, how do people actually navigate the system? In addition to that, when you go to navigate the system to get support, what is your experience? And the third question was, upon all of these, where do you go? How do you navigate it? What is your experience? What do you recommend based on that for an improved and enhanced alternate response to mental health and substance use in the city? So after gathering all of the data, we analyzed it, used in vivo. We also used hand coding And there were several themes that emerged from the research. And of course, after that, we went through a validation process again, where we went back to the participants to, share what we had found and whether it represented what they had told us. And in addition to that, we spoke to the people with lived and lived experience reference group as well and used them as a means to validate the data. And this is the most exciting part. So after all of that, it took us several months. This is a map of where people go. As you can see, the place most people go to when they are in crisis as a result of mental health and substance use is friends and family. And that's the reason varies. And it's because most of the people don't trust the several pathways that people go to for help. We also, through the research, found out that mental health crisis, as opposed to any other health crisis, is very unique. I have 5 minutes, so I'm rushing. People's experiences when accessing crisis response. And most people will not go to service providers because of certain experiences, which are one of this. We found that people cycle in and out of the crisis service, and that's because of the lack of coordination within the system, long wait times. Some people who use crisis lines had mixed experiences, negative and positive. And, racism was a big factor as well, and especially stigma when it comes to substance use, and people suffered other forms of discrimination. We did a race analysis of the data as well, trying to find out from the ACB community in particular, what were some of their experiences. People told us the fear of police due to negative experiences because police is the de facto responder. They do not like to call 911 when they are in crisis. People experience racism, discrimination, and this cut across all service providers, including paramedics, the emergency centers, and the counseling providers as well. And as a result of that, people rely on people that they can trust. So we asked people, what would you recommend as a result of your experiences? Recurrently, people told us that we should center racial equity in mental health and substance use crisis. We should, certain communities told us, for instance, the Somali community and the Black Francophone community told us they needed a community-specific solution, and that one-size-fits-all solution will not be able to serve the entire community. They also emphasized the idea of having a Black mental health professionals on staff, and most importantly, that we should come up with something that is non-911 crisis response phone number, because people do not like to call 911 when they're in crisis. I mean, we all know when you have a headache or you have a broken arm, when you call 911, the paramedics come. But when it comes to mental health and substance use and you're in crisis and you call 911, the police show up. Why is that? So because of that, people said, when you come up with any solution, it should be very separate from 911 and police should not be involved. So based on that, we proposed the pilot, and the pilot is a 24/7 crisis response in Ottawa. We propose a no wrong door approach. Although people said they did not want to call 911, we proposed this no wrong door approach because we know that some people will still call 911. Even when you are in crisis and you are not able to pick up the phone and call yourself, because 911 is so ingrained in us, some people might call 911 for you. When the call gets to 911, we want 911 to be able to direct that call to the non-police number. So that's why this no wrong door approach was recommended. So this led to every researcher's dream when you eventually come out with recommendations and not, just, put it on a shelf, but be able to recommend something that actually goes into practice is so rewarding. And so in our case, this is where it led us to. We ended up recommending a project called the Anchor, which was just launched in August in Ottawa, the first of its kind. It's open 24/7. Thank you. The vision is to go citywide, but we had to start somewhere and pilot it. And Centertown was recommended for that. 2 community centers, Centertown Community Health Center and Somerset Community Health Center, were chosen to implement this prototype. And right now it's going well. The number that people call to is 211 and not 911. We have a mobile crisis response team, which is made up of social workers, peer workers, and other professionals. It's a wraparound service. So from, once you are in crisis, they pick you up, and 24 hours, they'll be able to link you to other resources as well. And it's led by the community health centers. And this is a robust evaluation strategy that has been built in it. And this was funded by the city of Ottawa. I have to tell you that when they launched it, initially, they were anticipating that the first month they will have maybe about 90 to 100 calls. They've had over 500 calls so far. That tells you the need is large. So thank you so much. My time is up.